Hello, this is Mayor Chris Ballwage. Welcome to another edition of Our City. A few things going around the city of Elizabeth this week. First of all, some locations and websites where you can get the COVID-19 vaccine. You can register at ucnjvaccine.org, and that is for Kane University or the Peterstown Community Center. You can go to a CVS pharmacy. The availability is at cvs.com. Or Stop and Shop in our town. You can go to stopandshop.com/COVID-vaccine. You may also want to register on a website for Trinitas, which is covidvaccine.nj.org. Trinitas Regional Medical Center, the ShopRite at 865 West Grand Street, and other locations can be reached on that website. We are still doing testing here in the city of Elizabeth. The Department of Health and Human Services offers free testing at the Exlaven Recreation Center. It's in April, every Tuesday and Thursday from 3 p.m. to 7 p.m. and Saturdays 10 a.m. to 7 p.m. In addition, there are testing at the Stephen Sampson Center on Mondays and Wednesdays from 5 p.m. to 8 p.m. An appointment is not necessary. You could just walk in, but while insurance is not required, if you have it, we ask that you present your health insurance as well as a photo ID. Drive-through testing is also available at Kane University on Mondays from 8 a.m. to 12 p.m. and Thursdays 8:30 a.m. to 12 p.m. You can book an appointment there at ucnj.org/COVID-19 or just call 908-214-7107. That's 908-214-7107. And as I say every day, we must continue to follow the social distance rules. Wearing your face mask when you are out, washing your hands as frequently as possible, and keeping your 6 feet of distance. This virus has not gone away. While the numbers have been steady, it is still severe, and we must pay attention. Personal responsibility is extremely important. If you need any information concerning these events or any other events, please call our Public Information Office at 908-820-4124. Now, I'm pleased to be joined on this week's show by a good friend, someone who used to be the mayor of Woodbridge. Now, he really did well for himself. He went on to become the governor of this great state. But once a mayor, always a mayor. And now he is doing reentry work in the New Jersey Reentry Program. I give you Mayor, I got to do it, Governor Jim McGreevey. Governor, good to see you.
I thought this was a Ballwich rally.
Yeah, right. You know, I kiddingly say that in the beginning, but I know you were the governor of this great state. But once a mayor, always a mayor, right, Jim?
Always a mayor, Chris.
Yeah.
It's in your bones. Like I was just listening to you talking about COVID and where you can access services, and like a flashback came up to me. It's like, oh my God, God bless Chris. But first, I also want to say to one of your dear friends, Reverend Flores.
Mayor, God bless you.
Oh, Reverend Flores.
En español.
Mayor, felicidades por este extraordinario programa radial.
Poquito español, buenos días.
Buenos dias, you do a great job with this with this program.
Nice to see you, Pastor Flores.
Talk about Second Chance Agenda.
Why don't we put you on the show someday?
You should.
You know, I'm the humble slave of Jim McGreevey, and also I'm the humble slave of Mayor Chris.
Okay.
Anything I can do, I'm there.
We'll get you on. Okay, Jim, give me his contact.
2 seconds though. Reverend Flores is about to launch Spiritu Latino. And here, sit down. Tell the mayor what Spiritual Latino is about.
This is the new initiative of NJRC, and we have 17 countries to provide birth certificate, passport, and diplomas through the New Jersey Coalition of Councils of New York. And we'll be providing also immigration service to the reentry community and in Spanish language, but also close, full identification, GD classes, IT number, or make sure that the people pay the taxes, green card renovation. It's a lot of stuff. But I want to say something, but when you interview me, I have something to can talk.
Well, we're going to do that. We'll get a hold of you, okay, Pastor Flores?
Sure. Thank you.
Thank you, sir.
I just, and I just wanted, because it's so important, Mayor Chris, if I can, is because for so many of the Latino community that's court involved, unfortunately, particularly after the last administration, the federal administration, they were a focus of ICE, immigration. I mean, we battle this every day. We've got a case now. We're dealing with a young Dominican boy, who's not a boy, he's 19 years old, got involved in a problem. And so what happens is, Mayor Chris, if it's 364 days and under, he stays in the country. If it's over the penalty or the sentence is over 365, he gets shipped back to the DR. And so it's just crazy. And I just want to thank a reverend, and we work with the Catholic Archdiocese, we work with evangelical churches, we work with the community, Latino groups and immigration groups, but it's just helping people in real time. But it's called the Espiritu Latino, the Latino spirit, the spirit of God in our lives. But it's about doing real things, because if you're the Latino population and you're court involved, you're an immediate focus of ICE. And that's changed to a degree when Biden became. But I mean, a lot of the rules are still in place, so we grapple with that. But I just want you to talk to Reverend Flores. And that's why if you look at our staff, 25% are Dominican and 50% are from Mocha. No, but anyway.
So before we get into the work you're doing, you've been around politics and government for a long time. What was your motivation to get involved way back when?
So it's funny, Chris. It's there's an old adage. They say the Irish are good at priests, poets, and politicians. And so I figured I couldn't rhyme anything, and I didn't want to study 12 years of theology, even though I wound up going back to seminary later. But it was something like, you think you can make a difference in people's lives the same way you did. I mean, one of my favorite Chris Baldwin stories. I was up seeing a mutual friend of ours coming out of the hospital, and this is truth be told.
Mayor Gregorio.
Mayor Bobich had a list of all these names, and you were visiting from room to room to room at Trinitas. Was it called Trinitas back then? I don't know what.
It was when Mayor Gregorio was ill.
Yeah, it was John was there.
Right,
Maybe it was still the medical staff. But in any event, and I thought to myself, here's somebody who, out of a sense of conviction, out of a sense of mission, understands what it is to be a mayor, understands the ministry of service. And so I say this in my heart, that there are few people who do it the old-fashioned way. It has to be, so much, I think, Chris, so much of it has to be about your intentions. What's in your heart? I mean, do you care? Are you going through the motions, or do you really want to see the change? Do you really, taking time to see somebody when you're tired, or you could be home or whatever? I mean, it was just a gift to me. So,
well,
I think people should know.
I learned from you, Mayor.
Oh, so you're so full of malarkey. You knew from your heart. You knew from your heart, and that's why. I mean, that's why you are the success you are in Elizabeth. I mean, just in terms of waves of immigration and waves of people. It's also about doing things well. I mean, making sure that the garbage is picked up, make sure that the snow removal is done. It's basics. It's make sure that basic services, and then all the good development that you have in Elizabeth, but making sure that, working people can help build those buildings or live in those buildings. So that's, every time I go to...
So, Governor, I asked about you, and you went into a little bit about me, but that's very kind of you. But clearly the work that you're doing now, there has been such a void in our society for many, many years, probably forever. No one ever cares about people who are incarcerated and then have a second chance when they get out. And how do they get that second chance? You and your organization are providing that, and you built an organization from the ground up. Clearly the Reentry program started with you. While other people may have said, we're going to help and give second chances, you're making it a reality. So how did you get this program going? First you started with women, and now you're doing genders, correct?
Yep. And so it started, Chris, actually, when I was in seminary, the dean of the seminary said to me, Jim, go up to Harlem and work in a place it was called Exodus Transitional Ministry. Exodus comes from the book of the Bible, the Exodus, when the ancient Israelites leave Pharaoh's slavery and to look for the promised land. And a lot of guys, part of this, Chris, is, I don't want to overstate it, but in prison, you're told to do everything. So what happens is there's no sense of agency. There's no sense of self-direction. You're told when to eat. You're told when to go to the yard. You're told when to switch. You're told when to move, and you're told when to lock down. And so what you see over time is that people literally lose their sense of agency. They lose the sense of control. So there was a notion, and there's a great passage, and I think it's in Deuteronomy, when the Israelites are in the middle of the desert and they're like, Moses, we had 3 square meals and we had a place to live. What are we doing here in the middle of the desert? And I think that's also instructive for people in reentry. Obviously, in prison, you have your cot, you have your security, you have your food, but reentry is hard. So it's hard to do it on your own. And the whole notion for us is that we're providing critically needed support, whether it's your driver's license, whether it's food in terms of SNAP or food stamps, whether it's general assistance for temporary emergency housing, whether it's Medicaid so that you have prescription drugs. So if you took Chris Bolwich or Jim McGreevey and dropped us on Broad Street in Elizabeth without any food, without a license, without any ID, without any shelter, without any health care, without any Social Security, I mean, the only thing you could do is to go back to that street corner that you left from, to run, to gun, and maybe sell dope. So the whole thing is, if you want people to transform, you have to help provide them the tools that, frankly, any other American is entitled to. But after you come out of prison, out of 7 months, let alone 7 years or 17 years or 27 years, so much has changed, and it's hard, right? It's hard. It's hard, like, thank God my daughter, I have her do my taxes. Like, I can't figure out the forms, on the computer, you're doing this, or prescription drug benefits. My God, imagine if you're in prison for 12 years and somebody says, here's your health care, or coming out in the middle of COVID, and you go to knock on the door of social services and it's closed, and they say apply online, and the only thing you have is a flip phone. How do you apply online? So that's why, reentry is important, so that you can be able to provide those services to people, because it's tough. It's tough to come home. It's tough to have nothing. And most of our guys have nothing. I mean, they walk out of prison, Chris, and we'll talk about this later, but I mean, we've got guys that what they call max out. These are guys that served the entirety of their term, right? They didn't get parole, so they came out, and literally the only thing they got was a kick on the backside. They got a bus fare on the way out. They have nothing. They have no food, they have no shelter, they have no medical, they've got nowhere to go. These are the guys that are going to bus terminals. These are guys that are going to parks. Then they got the parole, and people that are, and we work with the state parole board, and they do a great job. And then people work with county probation, people that are in county jail, or people on probation. Now remember, the county is under a year, so that's 364. Over 365, that's state prison. Then we work with drug court, the guys and gals that are, have a problem with addiction and thankfully aren't in the criminal justice system. And then we have a small percentage of people that are in federal court. So that's max out, that's parole, that's county and probation, that's drug court, and that's federal. Those are the 5 streams. We've got 11,000 clients. Most of them, frankly, have addiction problems. I'd say over 3/4 of them. Some of them also have mental health issues, and a lot of guys still have, issues with hepatitis, diabetes. Like, you're in jail and you're using, guys actually melt down chest pieces to do a tattoo, and they're sharing a needle. Well, that needle is shared by somebody who might have had hepatitis. So we have a disproportionately percentage of clients that are coming out that have medical concerns, whether it's mental health concerns, depression, and for that they need their prescription drugs, addiction, but also medical concerns. So it's working to make sure we stabilize the client, stabilize the participant, get them structured sober housing, make sure we have their benefits before they start thinking about a job.
So, Governor, how did the people find out about you? I mean, like we hired Leonard Grayson here in our city based on the work you're doing, and he actually goes and meets with people who are
You're
scheduled.
breaking up a little bit, but I still hear you.
Oh, sorry about that. How's this any better? I'm getting closer.
No, it's just a little foggy, but that's all right. I understand it. So what we do is we try to work with the prison system, Mayor, and try to get them. So if Jim McGreevey's coming out and I'm going back to Union County, I tell you, well, this is the address where I go on Commerce, or this is the address I go in Jersey City on Summit, or this is the address I go on Bergen Street in Newark and for Essex. So we try to do it in prison, but COVID made it tough. And so that we work with the Department of Corrections. Sometimes we have better relationships than others, but the goal is that DOC gives everybody. But what we'd like is we'd like a hard handoff. That's what one of the things that we're working with the Senate President to change on legislation so that I can talk to Chris Bolwich behind the wall and say, all right, you're coming out on Monday. On Tuesday, you have a date to come to reentry. We want that hard handoff to make sure we provide that service.
Do you think that service would be receptive to the person that's coming out? That they would immediately go and.
Our guys want the service, Mayor. Chris, our guys, they trust us. We're not DOC. I mean, a lot of times they have issues with the Department of Corrections. I mean, obviously, I don't want to say to be fair to DOC, but if you've been there for 17 years and you've been dealing with DOC regs, I mean, you don't have a warm feeling, and I get that. And it's probably both sides of the fence. But I mean, with us, they know we've got a great working relationship with parole and probation and DOC, but our responsibility, our mission, Mayor, is to the person, to the court-involved person. So Jim McGreevey's job is to fight like heck to make sure you get your food stamps, you get your general assistance for your housing, you get your Medicaid for your, a lot of guys that have addiction are on Suboxone or Vivitrol. And they need that. They need that prescription. They need that Medicaid. So we fight really hard for our clients. I mean, that's our perspective. That's our focus. We're there to advocate. And I'll just say this, that we also work closely with a lot of prosecutors. Probably make some of my friends in the public defenders crazy, because if they just want people to get out, I don't want people just to get out. I want people to be sober. I want people to be productive. I want people to have good housing. So we'll work with prosecutors. Like in Trenton, I work more closely probably with public defenders on crazy long sentences. But I work really closely with the prosecutors day in and day out because they see us as a tool. I mean, the public defender, and I'm going to get myself in trouble, but they may want somebody just to get out. I want to make sure their addiction is treated. I want to make sure they have a good, safe, secure housing. I want to make sure they're employed in a training program. So we work really closely, and I'd like to compliment the Union County prosecutor, acting prosecutor. She's tremendous, and just work with to try to navigate, to help people help themselves. It's not about just getting out. It's about rebuilding your life. It's about living a healthy life. It's about, as you said, I just heard you in the beginning when you were talking about COVID, we have to be responsible. But a lot of these guys, Mayor, Chris, a lot of these guys weren't blessed with the families we were blessed with, don't have somebody who kicked us in the pants to hold us responsible. And so they're learning this, and that's our job in reentry, is to be locus and parentis, almost be supportive and hold these guys accountable.
So, Governor, you talked about employment, you talked about housing, and there's plenty of success stories. One of the things I would imagine is important is education as well. How many of the people coming out are looking to further their education, and what is your position on trying to help them with a higher education or even finishing high school?
Yeah, I mean, that's a great question. I mean, part of it, Mayor, is when you're looking at education, a lot of our guys, a significant percentage, Mayor, drop out of high school. They drop out of high school, they get involved, they run, they gun, and they dope, and then all of a sudden they find themselves in county jail, or they find themselves in prison. So I used to think that the solution was everybody gets a GED and everybody goes to community college. I mean, candidly, I don't think that way anymore. I think the most important thing, Chris, is that people get a job, but they get the training to have a skilled job. So we're just opening up this new facility in Kearney. Wendy New, Hugo New just gave this 25,000 square foot facility. We've got over 9 classrooms, but we're going to do CDL, HVAC, solar, electrical, plumbing, computer technician. So we're going to give people credentials, what they call industry recognized credentials. And so at the end of the day, if Jim McGreevey, and I don't do computers well, I can barely put in a CD. But if I get the certificate for an industry recognized networking technician, I'm going to get a job. We just had a group of guys go through New Communities Corporation to become diesel mechanics. All of those guys, Mayor, they all made $57,000 to $62,000 a year. So it's having credentials. It's not about, no disrespect to warehouses, but like, you know, you're in a warehouse for 30, 60, 90 days. Unless you're a 25-year-old guy and you've got a great back and you wear the gear. I mean, how long can you do that? You can't do that when you're 40.
Yeah, Governor, we're running out of time. I want to know about the rate of recidivism if they come through your program.
No, well, you promised me, Mayor, 3 hours. So I'm going to hold you on. No, no, we've got a great, Chris, our recidivism rate is one of the lowest in the nation. We say under 10%, but it's actually 8.8% or 8.7%. Our employment numbers took a dip, took a big dip during COVID. We were up to, our employment numbers was 62 to 64%. Now we're down to like 48.7%. So we dropped during COVID. A lot of our guys and gals are the last into employment and the first out. So that's why we're kicking off this new employment training center. We've got 11,000 clients and we're running these people through certification. So this is the new way to do reentry, is to have a certificate. At the end of the day, Chris Bolwich is going to hire Jim McGreevey, not because he likes, you know, the shirt he's wearing, but do you believe that I have the credentials necessary? So that's important. And I just want to say this to the audience. I want to say this to anybody that has somebody in your life that has addiction, whether you need detox, you need residential treatment or intensive outpatient. And I want to say thanks to Mayor Bolwich. Nobody gives a darn the way Chris Bolwich does. And so if you have a loved one who has addiction problem, we'll get you into detox, residential treatment, or IOP, or medication assisted treatment. We'll do that within 24 hours, 24 hours. And then whether somebody is your first language or Spanish or English, we don't care what your status is. We'll help you with your state benefits. We'll help you with your insurance. And we'll also help you with a job. And so I just want to make this commitment. I'm going to thank Chris Bolwich. I've known the mayor for so long, and his heart is there and he's always been a friend. But if somebody you know is suffering from addiction, contact New Jersey Reentry. And our website is www.njreentry.org, or contact Reverend Bolivar Flores in Spanish, and we'll get your loved one into addiction treatment within 24 hours, or we'll get them involved in reentry. So,
Governor, first of all, real quick, you also work with women as well, and that's extremely important.
Well, that's how I started. I worked with women. Women are a lot easier to deal with than the guys. You know, the young guys are knuckleheads. I'm blessed to have 2 daughters. But in any event, I mean, yeah, no, we work with about 20% of our clients are women, about 80% are men. And on the women's side, you know, we provide OBGYN, we provide women's health care, we connect women with something called the Women's Project. And I also want to thank Annette Giano. I want to thank her for her work with the Women's Project, which has been so valuable. But we provide OBGYN services. A lot of the women that are coming out of prison haven't seen a gynecologist in literally the entire time in prison. So that's why it's really valuable.
Hey, Governor, I know you're busy. You gave me a half an hour of your time. I really appreciate it. And thank you for all the work that you do in the reentry program. And it's really good to see you again.
I just want all of Elizabeth to know that Mayor Chris Bolwich married way up. He's got a lovely, wonderful wife. And to Nancy and to Jack, I just want to say thank you. And to everybody in Elizabeth, I'm just saying, being mayor, it's a lot of work. You're blessed with a great mayor. I know there's probably all these ridiculous, maybe not crazy laws, but I'm just telling you, I've seen mayors all over the state of New Jersey, and you're blessed. Elizabeth is blessed to have somebody who cares. Last thing is I'll say, Mayor Bolwich was in, what's the Latino church? Te Llama, Cristo Te Llama, during the course of COVID, where we were passing out food every day, where we were at the senior citizen down at the federally qualified health center, where the mayor allowed people from Elizabeth to be able to be housed. And nobody does this. Mayor Bolwich came at night. Mayor Bolwich came when we were passing out food. No cameras there, no publicity. So all I can say is Bolwich for mayor.
Thank you, Governor. And we both have daughters named Jacqueline.
Exactly.
Thank you. Thank you for your time.
God bless. Thanks, Mayor.
I want to thank Governor Jim McGreevey, former mayor of Woodbridge as well, Jim McGreevey. He's been a good friend, and the work he's doing in the reentry program is second to none. This is Mayor Chris Bolwage. We'll see you next week on another edition of Our City.